Hey, welcome. My name is Rachel Smith, and this is the Natural Health Rising podcast. I am a certified functional diagnostic nutrition practitioner and the owner of Natural Health Rising, which is my online holistic functional medicine company where I help people who have autoimmune diseases, chronic illnesses, mystery symptoms, and a whole host of other imbalances restore their health by natural means. On this podcast, you're going to hear conversations between myself and other health experts on functional medicine and general holistic health. My goal is to provide you with the tools you need in order to help you rise to your healthiest and happiest self.
So on this episode, I have Dr. Meg Mill with me. Dr. Mill is a functional medicine practitioner, best-selling author, speaker, and host of a Little Bit Healthier podcast. In her virtual functional medicine practice, she works with patients worldwide to heal the root cause of their health struggles through advanced diagnostic testing and personalized support. With her 2 decades of clinical experience in conventional and functional medicine, she can help people improve their health naturally while still understanding and respecting conventional practice protocols. She's been seen on Fox News Channel, ABC, NBC, CBS, CNN, and in Reader's Digest and Health Magazine. Welcome to the show.
Hello, thank you for having me.
Yeah, I'm super happy you're here. Glad we got to connect at Mindshare this year.
Yes.
I always love to start off with just getting to know people's stories a little bit more. And I'm curious, what got you into the field you're in today in functional medicine? And if there's any personal health journey that's kind of tied to this, if you can tell us a little bit about that path.
Sure. Yes. So I feel like so many of us in the functional medicine space, there is that personal journey.
Yeah.
It's kind of like what brings you over. So yes, I was practicing. I was a PharmD and then did a residency in ambulatory care, clinical pharmacy. And so I practiced in like medication management clinics. I was in different spaces in that space. And I know like I was saying, the protocols and the conventional space and why we're putting people on certain drugs and why we should be. At the same time, I was really seeing people really living in this place where they were just surviving. They weren't thriving. They were getting more medications. They really weren't feeling better. And I'm like, there's got to be a better way. And at the same time, I was also having a lot of gastrointestinal issues. So like I was getting all these tests and I would go to gastroenterologists and have tests run. And, it's like, okay, do you have celiac? Do you have all these? And then they would just like slap IBS. I feel like IBS is just like, we don't know what's going on. You don't feel well, we can't find it. And so, that's what they call it sometimes. And so I was still having all these issues and I just couldn't get to the bottom of it. We moved through that time and I would go to like another specialist. And so I wasn't getting any answers. And it really wasn't until I found functional medicine and started reading into it and started learning about it that I started practicing some of those protocols on myself. And then I started to finally feel better. And so then I was like, oh, I need to go back and get certified in functional medicine and really change so I went back to, getting educated and really changed my whole practice. So now then I opened up a functional medicine practice and I see people all over the world now. And it's really amazing because you actually see people feel better. It's like these things that we could be living with for so many years that we're thinking like, okay, that's just how we have to live. But when you really find the root cause and make some of those connections, it can just make you feel so much better.
Yeah, that's amazing. When you started to dabble in the functional medicine stuff for your own health, was there a specific thing that you tried that really made a difference where you're like, oh, wow, this actually works?
So I think with gut health, sometimes it's about finding that root cause and actually figuring out what you're treating. So, we can start with adding, you can start with the basic things like adding fiber, digestive enzymes, adding more stomach acid. Those are all things you can just do on your own. And really we're getting so many more people talking about a lot of those things that it's great. But once I had some underlying, I had some overgrowth that was in my gut. I had some, when we do that stool test, we can really pinpoint, do you have a parasite? Do you have candida? Do you have SIBO? Do you have, different things? And once you can literally actually pinpoint and treat those, it can make you feel so much better. And so I think sometimes you need to go beyond just taking care of your gut health if you're already someone who has symptoms, and really identify where that is for you.
Yeah. Is that like a core test in your practice, is doing some sort of gut test?
I do a lot of stool tests. Yes.
Yeah.
And I mean, we're talking a lot, I think about headaches today and stuff too. So,
Yeah.
even when people are coming to me for, you're looking at like a headache, or I see a lot of women for hormone balance, or, thyroid issues and different things. And I'm like, well, we should probably do a stool test. And they're like, but I'm coming for this. And we're like, yeah, but your body's so connected. And sometimes,
Yeah.
when we see those underlying things in the gut, it can, because your body's fighting that inflammation. If you have that underlying issue, now, not everybody does, but if you do, your body's inflamed often because you have this underlying infection going on that your body's having to respond to all the time. So it can be as simple as so many things, skin issues. There's so many things that can really clear up once we really can heal the gut.
Yeah. Is there a specific test that you use?
I like the GI map stool test. That's one that I've been using a lot right now. So
Yeah.
but I have used other ones in the past too.
Okay. Yeah. That's what I use too. I love it.
Yes, I do. Yeah, I think it's a very good test. Yeah.
Yeah. Awesome. Well, you just brought up headaches a little bit. So let's dive into that, because I know that's one of your major areas of focus. And I don't think we've talked about it on the podcast yet. So I'm pretty excited for this. Let's just start by breaking down, because there's lots of different types of headaches, right? Like tension and cluster, and there's migraines. Can you explain the differences between some of those things? And then after that, maybe what are some of the root causes that could be different based upon what the type of headache is?
Mm-hmm. So when you're talking about, like, let's say the most common type of headache is a tension headache. And so you're most likely in the tension headache going to feel like a band across your forehead, where you feel like that pain, kind of like pain and a tightness and a band. And there's really not usually a pattern to a tension headache.
Mm-hmm.
It can vary in length. They don't usually last for like days at a time. It's kind of can come and go. And that would be what most people, those can be from like often dehydration, structural issues, there's like several things that can really cause that in all the headaches, but that would be one that we see most common. So then the most probably people that I see affect people's lives the most are migraines. So migraines are going to typically be more of a stabbing or throbbing pain. Now you can have that full head pain, but a lot of times we'll start on one side and be like singular sided. With migraines, you often have a pattern. So we'll see like potentially have an aura start where you can have nausea. Those actually feel often better when you're in a quiet, dark place. So when you're like with out of lights, laying down, able to calm the body. So then you can get a cluster headache, which is actually movement usually helps a cluster headache feel better. And those are usually short duration, but very intense. So it's like an extreme pain, almost like people could say like like someone's like pounding an axe into your brain. Like it's very intense pain, but short period of time, and often feel better when you're moving around. So if you're like, you shake your head and it feels better, it could be a cluster headache. And that's more often associated with men. Men get more cluster headaches than women. And then and then there's a whole, beyond those most common ones, there's a whole array. So you can get headaches from having low blood sugar. We sometimes see serotonin imbalances. We see all sorts of different headaches, reasons for headaches. Some people get vestibular migraines, all sorts of different things, but those are the most common reasons. And a lot of the time I see for hormonal headaches, for migraines, we see a hormonal component to the migraines.
Okay. What's normally going on with the hormones at that point?
So the two most common things that happen for hormonal migraines are estrogen dominance or rapid change in hormones. And so that's why if you're someone who gets the migraine, well, if you're really getting it like at ovulation time or the week before your period, sometimes people just know like, oh, I'm going to get my migraine right before my period starts. that's because at that point, the estrogen and progesterone are both going down, but often the progesterone can be going down lower than the estrogen or faster, or we just don't have enough progesterone to balance the amount of estrogen that we have. And so we become estrogen dominant. And so a lot of times when people are estrogen dominant, they're going to get the migraines. And so we need to look at different factors here. We need to look at how much, that's why in this case, I often would say testing is a way to go. So doing a hormone test, because with hormones, it's all about balance, and we need to really keep that balance. And sometimes when you're doing the guesswork, you can be potentially putting your hormones out of balance in a different way without the testing. So we want to look at if you have low progesterone in comparison to your estrogen. We also want to look at the total amount of estrogen and then the way you're metabolizing the estrogen. So a common pattern I see with women who get hormonal migraines is sometimes not actually that they have huge amounts of estrogen, but that they're not metabolizing it the way they should. So we need to use it and lose it when it comes to estrogen, I always say. So it's like you need enough, but you don't want to hang on to it. And sometimes when it goes down the wrong pathways, we're seeing this excess estrogen that's more proliferative. And so you see these symptoms start to come. So one of the things that you can start doing right now is just sort of looking at your environment. I mean, we have endocrine disruptors around us all the time. You've probably talked about endocrine disruptors and really just starting to look at, what kind, how are you keeping your food? Are you storing it in plastic containers with BPA? That's a big one, because with BPA, with those plastic containers, we're often not only keeping our food in there, but we're also then often recommended to put it in the microwave or dishwasher to wash them. And then it breaks down the composition of the plastic of the BPA, which can leach into your food more. So that's like a simple step, just doing one thing it can feel overwhelming, but just doing one thing at a time. I always tell people, like, if you're going to change your product, start to look at Skin Deep on ewg.org and start to think about it, but just replace one thing after another. You don't have to go invest like so much money. You can just switch it out. When you're done with something, replace it with something else that's clean.
Mm-hmm. Yeah, I love Skin Deep. That is like the best website ever.
It's just such a good resource, because I mean, when you look at all those words that you don't understand and you're like, I don't know if my product's okay.
Right. Yeah. And then they
Yes.
have a rating right next to that word that you're like, I don't know, what is this, a chemical? What is this? And just have your answer right there. Okay.
Yes. Yeah. So that's a good resource. It's free. Everybody can go there and just check.
Besides estrogen disruptors, what are some other common things that are raising estrogen in men or women?
Yeah. So another thing is you want to look at your dairy and your meats. So we often are also eating things that are laden with hormones, because, our cows are fed hormones. So then, I was watching like a documentary one time on, all the antibiotics and the hormones that animals are fed that, we're eating without even thinking about it. You're not thinking of the things that your food has been ingesting. So we just want to be careful. Like that's another good place to start. Like when you're getting your dairy products, when you're getting your meat products, that you're getting organic, that hasn't been fed with hormones or even antibiotics, and just really starting to clean up your diet there is another place that I think can be very helpful.
Mm-hmm. Okay. So choosing like organic and grass-fed sources for that stuff. Okay. Awesome. And are you using the Dutch test for the hormones? So
that is the test I generally use. I do have a few different ones, depending on the needs of people, but I do like the Dutch test, particularly for the headaches, because we do need to see those metabolites. That shows so I think this is, if you're just going to your doctor and you're getting an estradiol, like we're talking about like an estradiol blood level, you're just getting that one blood level, one snapshot in time. Our hormones fluctuate all the time. So, with that Dutch test, we get 4 or 5 different samples. So we get to see a variety, but also we're only seeing if you have estradiol. And so often, like I'm saying, I see that low or, normal to low, but I still see these high metabolites. And then we just have to figure out, once we know the pathways, we can move the metabolites the way we need to in order to really get your estrogen process right.
Mm-hmm. Absolutely. So if someone is currently struggling with headaches, migraines, and their go-to is probably something like an ibuprofen or an Advil, which is what I'm assuming.
Yes.
Are there alternatives? Well, actually, before we get to the alternatives, can you speak on why someone might not want to use those things if it's affecting their liver or their gut or anything like that?
Yeah. So that, we're talking about how like the gut can be the root of a lot of these things. And so what happens is we know that ibuprofen actually disrupts the lining of your gut. And so, if you go back to the early 2000s, they created the COX-2 inhibitors because we knew of all the problems that the regular NSAIDs were having on our GI health. And so they, created these selective agents that were like Mobic, and they're not on the market. It was like $1 billion industry that was like, this is the best. And then we realized cardiovascular disease shot up when using them. And then, they took them off the market because of the danger. But the theory behind that was to do more protection of the gut health, because that is also creating this intestinal permeability, leaky gut. It's a disruptor. So really you're treating your pain with something that you're just covering up the pain. So really you're doing nothing when you're using those agents. You're not really doing anything to fix the problem. You're just covering up pain. And then it's actually making things worse because you are creating this imbalance in your gut, which can actually create more inflammation and more headaches. So although you're treating the pain, it can actually backfire sometimes. And, and then Tylenol is processed by the liver. So we also need our liver. We were talking about our estrogen, we metabolize our estrogen, we metabolize our toxins, we metabolize other things in the liver. So when you're metabolizing the Tylenol and you have too much Tylenol in your system, then you can be disrupting some of those processes too. So you just want to be careful. You want to think of it. This is a silly analogy, but I like to use it because I think it kind of gives a good example here. If you took your car to a mechanic and you said it was making noise, and you gave your keys to the mechanic and they walked away, and you expected your car to be fixed, and they went away and they grabbed a pair of earmuffs and handed you your keys back and just put the earmuffs on and drive away, like with the noise in your car. You'd be like, I'm not driving my car. Like, that's dangerous. But when it comes to headaches and migraines, that's often the approach we're taking. We're just worrying about pain management. We're just covering up the pain. We're not actually really ever getting to the root of the problem.
Mm-hmm. Okay. Really great explanation. So what are some natural alternatives if someone has a headache or migraine come on? What can they do instead of the over-the-counter medication?
Yeah. So one of the things that I see people have a lot of success with is actually essential oils. So putting like peppermint or lavender on your temples and actually putting like so first of all, you want to drink a glass of water, because dehydration is an independent risk factor for headaches and migraines. And a lot of us don't get enough water. So you want to make sure that you're getting, trying to aim for around half your body weight in ounces of water daily. And then another thing with the water is making sure you're getting water at really a cellular level. So making sure that you're sipping your water through the day, that you're not chugging it all at once, that you're keeping yourself hydrated. So I would say that, and then putting like like I said, a peppermint or a lavender essential oil, putting a cool cloth and getting to a place that you can just calm your body down as fast as possible. You can do things that are, also pain management, and even taking something like a curcumin as an anti-inflammatory. Sometimes that can make a difference for people, to have that as an alternative and things like that.
Okay. Curcumin. What would be, and this is not medical advice to anyone, but like, what would be a dose that someone would take of curcumin to really get rid of the headache?
Yeah, I think just usually a 500 milligram capsule would be something that, yes, that's not medical advice. Yes.
Okay.
That's generally they come in that.
Awesome. Okay.
Yeah.
So if somebody wants to, they know they have headaches and migraines, they want to start solving this naturally, what are some of the top things that they could start doing to get rid of these altogether eventually?
Well, first thing I think is to look at your food. So food does play a factor. And so that's something we're not thinking about necessarily. And food can be really complicated when it comes to headaches because they're not always foods that we feel are bad for us. You can be, I've seen so many people like, it could be lemons, it could be olives, it could be avocados. There's different foods that potentiate these. And so one of the things that you can actually start doing is print out a blank calendar and then write down what you ate that day and the day before on a calendar when you get your headache and start to see if you see patterns. It's like also a little bit complicated here because the other factor when we're talking about food is a threshold. So sometimes you could eat a food that is a migraine trigger and you feel like, okay, I got a migraine. That's one of my triggers. But then you could have that again and not get the migraine. Well, maybe you didn't have as much of it. Maybe you didn't have it in combination with another food that put you over the threshold. Maybe so actually looking at the food patterns in combination and amount. And so I know it gets confusing, but it can be really enlightening if you do it. Once people start to do it and look at this pattern for a while, it's amazing some of the things that you can start seeing. And then also looking at your individual food sensitivities. So we have IgG antibodies elevated when we have a food sensitivity. So if, I do food sensitivity testing, you probably do too, but, there's different philosophies like doing an elimination diet with some of the most common food sensitivities, really looking at that data, but pulling some of those out. And those can be confusing too, because they can happen 4 to 48 hours after. So that's why I say the day of and the day before. You could get your headache the next day, even if it's a food that you started on that day.
Mm-hmm. Okay. So you use IgG testing because there's all these different kinds of panels nowadays. And I think people get very confused on like, what is the right thing to use? Because now we have them open to consumers. And so they're going and buying a bunch of stuff, but then they're just left with this sheet and they're like, I don't know if I got the right thing or like, what should I be looking for? Do you have a preference on that?
Yeah, I've done a lot of comparisons. I don't think they're all created equal. And so that, you can get different tests that you will like. I did it to myself last year because there are a lot that are out there that are cheap. And if you can use them and they're less expensive, I'm all for that. So I did like a panel on myself of like comparison, and you can get a lot of different results. So I just would recommend if you're going to invest, go to someone who like has a test that go to a provider that has a test that you trust, that they've seen good results with and can validate that you're doing it. Cause they're not cheap. Some of them aren't even cheap that you can just buy on your own. And then like, are you getting the result? Is it worth it?
Right. Yeah, exactly. Okay. So is there anything else besides food that people could start with?
Yeah. Another thing, this is so simple, but sleep. So, sleep is another independent risk factor for headaches. And we don't always look at our sleep. We can think like, oh yeah, I sleep fine, I'm getting sleep, but are you really getting good quality sleep? I know sometimes when we really look at that, it's like surprising. I had someone come in that was like, I'm sleeping great. And I went back through I do a really detailed intake questionnaire when people come in, and I went back through it and I was like, you're staying up like one night a week, almost all night. She was using that as catch up. And she was like, so she was thinking just because she slept on the other nights, but when you do something like that and you're like getting that pattern that your circadian rhythms off, that can make a big difference. And REM sleep is a decrease in REM sleep is associated with migraine. So just start making sure that you're prioritizing sleep, that's not something, especially, over the holidays, you can get into a pattern of like, I got to stay up and get everything done, but that you're really focusing on sleep and hydration. Those are back to the basics. Then we want to look at, we talked about food, we talked about hormones. We want to look at stress. That's another thing that I call the chain of pain, because stress is not just about our to-do list. It's about what we have going, like the stress on our body. And so pain's a stressor. And so when we're, pain can increase cortisol, which can, then it can increase other hormones that increase pain, and it goes back in a cycle. So really just working on things that reduce your stress, deep breathing, meditation, anything that's really resonates with you. I know that's sometimes hard because we live in a busy world, but anything we can do to really bring our body back to that parasympathetic rest and digest.
Okay. So outside of food sensitivities, are there actually specific foods that someone could eat that are beneficial to headaches or migraines?
Yeah, so one of the most common food like nutrient deficiencies that I see is magnesium. So that's a common one for people that suffer from headaches. So if you can start getting foods that are high in magnesium, so that would be pumpkin seeds actually have one of the highest levels of magnesium, and that's something that's easy. Like you can sprinkle that on a salad and a smoothie, something. But even doing like Epsom salt baths is another way to increase your magnesium. But that would be one, things with omega-3s like salmon, omega-3 fatty acids are good. So those are things we can add, but I would start there. Those are good foods. Eggs actually are another one because they have nutrients that are good, and they also have choline, and choline also is another way that we metabolize estrogen. So some of these foods are good because they can help in several different ways. But those are maybe some places to start.
Okay, awesome. Pumpkin seeds, salmon, and eggs. Love
Eggs,
that.
yeah.
Yeah. Okay. So when somebody works with you, how long does it normally take for someone to totally alleviate their chronic headaches and migraines?
Yeah, and that's a good question because everybody's different. So it's hard for me to answer that. But I did, like, this is another story. I had two sisters that started on the same day. They were both had headaches as long as they could remember. Like they were probably mid-30s and had headaches since they were teens. And they thought like it was just a part of their life. And we started supplements and, really like dialing in within 3 weeks. One sister was like, I can't even believe it. My headaches are gone. Like, this is a miracle. I could never imagine this. And she was like, felt amazing. So then I have the other sister who's like looking at me, she didn't say anything, but it's like, okay, well, I'm still like not changed. I have these headaches. And I just was like, be patient. She wasn't complaining, but I'm like thinking in my mind, be patient. And it was about 2.5 months to 3 months later that she was like, they're gone. It just, everything in her body took 2 to 3 months. So it is a long game when you're doing something like this. I mean, I do think that the great thing is that you can see them. I see them every day decreasing dramatically in both incidence and severity. So where you're able to come off the medications or migraines, that you're able to live without worrying about, headaches. But one of my favorite quotes from someone I work with is like, I no longer wake up feeling like, is it going to be a headache day? It doesn't even affect my life anymore. But you do have to, it isn't something that like the Advil or the Tylenol, like, okay, today it's done. It takes some time to figure it out. It takes some testing to really dig into what's going on and putting all those pieces together. But when we do that, we really see these dramatic results.
Mm-hmm. Yeah. And you kind of brought up prescription medications. Like, what are some of the implications of getting injections or being on these prescriptions for these issues?
Well, it's different for each medication, but you just have to remember that every medication has side effects. So I think we all brush it off. Like I always would say, these commercials come on TV and it's like, this is the greatest drug ever, but it causes like a list of all these things that are terrible. And, we laugh about it, but we still take it and we don't think anything of it. And they do have side effects. So whatever you're putting in your body has a side effect. So it's not everybody gets every side effect, but they're not without consequence. And some drugs, I'm not going to label any drugs right now, but there are certain drugs that make people feel pretty lousy on a daily basis. So you're taking some of these medications that are to treat your headaches, you're still getting the migraines and you're getting these side effects, and it's not fun to live that way. So when you can get off the medications, it feels great.
Yeah, absolutely. Okay. You did mention blood sugar causing headaches a little bit. And I love talking about blood sugar because I see a lot of issues with it. Can you talk a little bit about like, what does blood sugar dysregulation mean? And even outside of headaches, like what else could be happening in the body when we have these issues? Let's start there first.
Yeah, sure. So blood sugar, really when it comes to headaches, it's more low blood sugar. So it's more of a hypoglycemia. But what starts to happen is once we start to get blood sugar dysregulated, on our standard American diet, we're eating a lot of carbohydrates, more so than we really should be when we're balancing our blood sugar. And so what starts to happen is you're getting these carbohydrates that are going into your blood. And, particularly when you're getting things like fructose, which is really, it's not, doesn't attach to fiber. It doesn't, it's not hard to digest. So you're getting these really high levels of sugar. And once you have the high blood glucose, you need a lot of insulin because you need it to be in your cell to be effective. So the blood glucose doesn't give you energy. It has to be in your cell to get the energy. And so we have insulin, which is really like a lock-in key to get the glucose into the cell. And then, so you're getting the blood sugar, it goes up, the insulin's raising to get it all locked into the cells, into the cells, into the cells. And then it drops because you have this huge surge of insulin getting it in. So you end up getting these patterns of high, low, high, low, high, low, where you're getting up and down all day. And so when we're getting that swing in blood sugar, particularly when we get the drop, that's when we're seeing a lot of the headaches. And, I think it's a little bit of a misstep. We check blood glucose. So in your standard blood work, you're going to see a fat actually. And I have a podcast called A Little Bit Healthier that I do a whole episode on this because I think it's episode 7, that because I really see this regularly, it's about the understanding of how this works, because what happens is we get a blood glucose level at our regular yearly checkup. So, it's inching up often for people over the years, but sometimes that can stay normal, but you still get a high insulin first, and we're not checking the insulin regularly. So you can have hyperinsulinemia before you actually get that high blood sugar, because your insulin, your pancreas is compensating for the sugar. So it's like, okay, it's compensating. We start to get insulin resistance, and then our blood sugar goes up. But if you can look at your insulin levels and make sure they're in the right place, that's actually a better way as we start out with blood sugar dysregulation to start seeing.
Mm-hmm. Okay. So what are your favorite blood sugar hacks for people to change, whether like how they eat or minerals they take? Tell me more about those.
So I like to have people just start a first step to try to start pairing your carbohydrates with a protein. So you want to try to pair, really think about a lot of people that I work with don't eat enough protein. It's a harder thing to get into our diet, especially if you're not a huge meat lover. So we're always working on ways to get protein in without meat. I mean, because not everyone wants to eat meat all the time. And so, actually adding that, especially in the morning, trying to get a higher amount of protein in and start pairing and thinking about like that pairing when you're having your carbohydrates. Like, are you pairing that with a protein? Are you pairing it with a healthy fat? How are you pairing your food? As is a place we often start. How about you?
Yes, that same thing, getting people to pair carbohydrates with proteins and fats, and then having them also try and eat the protein and veggies with fiber first before they even get to the carbohydrates is another one of my favorites.
Yes. Yeah. Cause it can make a big difference. And then you're full on that. You're in it's the way you process the blood sugar, but then you're also more full. So you're not gorging, when they bring the bread to the table before the meal, that's like probably the worst thing.
Yeah.
Then you're
actually
eating all the bread and you're getting that spike before you even get to the food that you ordered. And so it's backwards, right?
Yeah. Probably should order a salad before that and eat that with the bread.
Yes, exactly.
Yeah. And I like going on walks after meals too, or like a bigger meal, take a quick 5 to 10 minute walk if you have time to do that, or any kind of movement.
Yes.
Do you have people take minerals at all for blood sugar balance? Or like any
Sometimes I
specific
do.
herbs?
Yeah, I do that more specifically depending on what the person has going on with their whole health history. So it would be more like, okay, where is your insulin? Where is your glucose? Where's your hemoglobin A1C? Like, what do we actually need to do as far as like treatment?
Okay, awesome. Have we missed anything that you like really love to talk about with headaches and migraines?
I think we basically covered most of the things. So, you want to just like look at your hormones. You want to think about stress. You want to think about your gut health. your food, your sleep, your hydration, and put all the pieces. What we really want to do is start putting all of those pieces together. It's almost like a web, and really unravel that web. And once you start making all the connections, because everything's connected to each other, we just start to see the huge difference.
Okay. Amazing. I have one final question, and just say whatever the first thing comes to your head is. Don't stress about it. So if you could leave the listeners with one tip to help them live a healthier, happier life, what would that be?
I think sleeping, actually. We get so much restoration in our body when we sleep. And I think it's something that we can easily let go because we want more time in our day. Maybe that's the time of your day where like everybody's asleep and you get your personal time, or where you finally get to wind down. And so we won't sleep as much because we're taking that time. But if you can actually prioritize sleep, even with energy and digestion and immunity and all the things, it really makes a big difference.
Okay. That's a great tip. I think especially during right now is wintertime, and a lot of people are getting the flu and getting the cold, and you have to be sleeping to have your immune system be strong to combat those things. I've been thinking about that a lot this past couple of weeks, is like, I'm determined to not get sick this winter. So I'm like, okay, I got to stay on top of my sleep.
A good goal, yes.
Well, thank you so much for being on. Do you want to share where people can find you, or if you have anything you want to share with the listeners, go ahead.
Yeah, great. So I have a podcast called A Little Bit Healthier, and it's on all the major networks. And then I'm over on Instagram at Dr. Meg Mill. It's just Dr. Meg Mill, Megmill. I have a website at megmill.com. And I actually have a free guide that everyone can download if they do have headaches, called at helpmyheadaches.com. It's just helpmyheadaches.com. And there's 8 steps for you to get started right now.
Oh, that sounds wonderful. I have all of those links too. So we'll put those in the show notes. So you guys can just go to the show notes and click on the free guide or wherever, if you want to work with Dr. Meg. So thank you again.
Thank you so much.
Thanks for watching the episode. I really hope you enjoyed it. And if you did, make sure that you like the video and leave a comment and share it with a friend who really needs to hear it. Because when you share this information, you're also going to help other people level up their health. And if you or somebody else you know wants to work on their health and they're looking for a functional medicine practitioner, feel free to reach out to me to apply to work together. Thanks for watching, and keep striving to become your healthiest, happiest self.